In this section, we will talk about the mechanism of blood coagulation. Well, more than 50 important substances that cause or affect blood coagulation have been found in the blood and in the tissues. Some that promote coagulation called procoagulants, and others that inhibit coagulation called anticoagulants. Whether blood will coagulate depends on the balance between these two groups of substances. In the bloodstream, the anticoagulants normally predominate. So the blood does not coagulate, while it is circulating in the blood vessels. However, when a vessel is ruptured, procoagulants from the area of tissue damage become activated and override the anticoagulants, and then a clot does develop. Clotting takes place in 3 essential steps. First is that, in response to rupture of the vessel or damage to the blood itself, a complex cascade of chemical reactions occurs in the blood, involving more than 12 blood coagulation factors. The net result is the formation of a complex of activated substances, collectively called prothrombin activator. Second is that the prothrombin activator catalyzes the conversion of prothrombin into thrombin. And third is that the thrombin acts as an enzyme to convert fibrinogen into fibrin fibers. Many fibrin monomer molecules polymerize within seconds into long fibrin fibers that constitute the reticulum of the blood clot. In the early stages of polymerization, the fibrin monomer molecules are held together by weak non-covalent hydrogen bonding, and the newly forming fibers are not cross-linked with one another. Therefore, the resultant clot is weak and can be broken apart with ease. However, another process occurs during the next few minutes that greatly strengthens the fibrin reticulum. This process involves a substance called fibrin stabilizing factor that is present in small amounts in normal plasma globulins, but is also released from platelets entrapped in the clot. Before fibrin stabilizing factor can have an effect on the fibrin fibers, it must be activated. The same thrombin that causes fibrin formation also activates the fibrin stabilizing factor. This activated substance then operates as an enzyme to form covalent bonds between more and more of the fibrin monomer molecules, as well as multiple cross-linkages between adjacent fibrin fibers, thus adding tremendously to the 3-dimensional strength of the fibrin meshwork. Now, let's discuss the conversion of the prothrombin to thrombin. Prothrombin activator is formed as a result of rupture of a blood vessel, or as a result of damage to special substances in the blood. Prothrombin activator, in the presence of sufficient amounts of ionic calcium, causes conversion of prothrombin to thrombin. Thrombin causes polymerization of fibrinogen molecules into fibrin fibers within another 10 to 15 seconds. Thus, the rate-limiting factor in causing blood coagulation is usually the formation of prothrombin activator, and not the subsequent reactions beyond that point, because these terminal steps normally occur rapidly to form the clot. Platelets also play an important role in the conversion of prothrombin to thrombin, because much of the prothrombin first attaches to prothrombin receptors on the platelets that are already bound to the damaged tissue. Let's have a detailed discussion of properties of prothrombin and thrombin. Prothrombin is a plasma protein, alpha-2 globulin, having a molecular weight of 68,700. It is present in normal plasma in a concentration of about 15 mg per deciliter. It is an unstable protein that can split easily into smaller compounds, one of which is thrombin, which has a molecular weight of 33,700, almost half that of prothrombin. Prothrombin is formed continually by the liver and is continually being used throughout the body for blood clotting. If the liver fails to produce prothrombin in a day or so, prothrombin concentration in the plasma falls too low to provide normal blood coagulation. Vitamin K is required by the liver for normal activation of prothrombin, as well as a few other clotting factors. Therefore, lack of vitamin K or the presence of liver disease that prevents normal prothrombin formation can decrease the prothrombin to such a low level that a bleeding tendency results. Now, let's discuss the coagulation cascade after vascular injury. Exposure of blood to the vascular wall causes release of tissue factor, also called factor 3 or thromboplastin, from endothelial cells, phospholipid expression, activation of thrombin, which then acts on fibrinogen to form fibrin, and fibrin polymerization to form a meshwork that stabilizes the platelet plug. Moving towards conversion of fibrinogen to fibrin and formation of clot. Fibrinogen formed in the liver, essential for clot formation. Fibrinogen is a high molecular weight protein, which is approximately 340,000, that occurs in the plasma in quantities of 100 to 700 milligram per deciliters. Fibrinogen is formed in the liver, and liver disease can decrease the concentration of circulating fibrinogen, as it does the concentration of prothrombin, as discussed before. Because of its large molecular size, little fibrinogen normally leaks from the blood vessels into the interstitial fluids. And because fibrinogen is one of the essential factors in the coagulation process, interstitial fluids ordinarily do not coagulate. Yet, when the permeability of the capillaries becomes pathologically increased, fibrinogen does leak into the tissue fluids in sufficient quantities to allow clotting of these fluids in much the same way that plasma and whole blood can clot. Now, let's discuss the action of thrombin on fibrinogen to form fibrin. Thrombin is a protein enzyme with weak proteolytic capabilities. It acts on fibrinogen to remove 4 low molecular weight peptides from each molecule of fibrinogen, forming 1 molecule of fibrin monomer that has the automatic capability to polymerize with other fibrin monomer molecules to form fibrin fibers. Therefore, many fibrin monomer molecules polymerize within seconds into long fibrin fibers that constitute the reticulum of the blood clot. In the early stages of polymerization, the fibrin monomer molecules are held together by weak non-covalent hydrogen bonding, and the newly forming fibers are not cross-linked with one another. Therefore, the resultant clot is weak and can be broken apart with ease. However, another process occurs during the next few minutes that greatly strengthens the fibrin reticulum. This process involves a substance called fibrin stabilizing factor that is present in small amounts in normal plasmaglobulins, but is also released from platelets entrapped in the clot. Before fibrin stabilizing factor can have an effect on the fibrin fibers, it must be activated. The same thrombin that causes fibrin formation also activates the fibrin stabilizing factor. This activated substance then operates as an enzyme to form covalent bonds between more and more of the fibrin monomer molecules, as well as multiple cross-linkages between adjacent fibrin fibers, thus adding tremendously to the three-dimensional strength of the fibrin meshwork. Moving towards blood clot. The clot is composed of a meshwork of fibrin fibers running in all directions and entrapping blood cells, platelets, and plasma. The fibrin fibers also adhere to damaged surfaces of blood vessels. Therefore, the blood clot becomes adherent to any vascular opening and thereby prevents further blood loss. Now, moving towards the clot retraction and expression of serum. Within a few minutes after a clot is formed, it begins to contract and usually expresses most of the fluid from the clot within 20 to 60 minutes. The fluid expressed is called serum because all its fibrinogen and most of the other clotting factors have been removed. In this way, serum differs from plasma and cannot clot because it lacks these factors. Platelets are necessary for clot retraction to occur. Therefore, failure of clot retraction is an indication that the number of platelets in the circulating blood might be low. Electron micrographs of platelets in blood clots show that they become attached to the fibrin fibers in such a way that they actually bond different fibers together. Furthermore, platelets entrapped in the clot continue to release procoagulant substances, one of the most important of which is fibrin stabilizing factor, which causes more and more cross-linking bonds between adjacent fibrin fibers. In addition, the platelets contribute directly to clot contraction by activating platelet thrombocytinin, actin, and myosin molecules, which are all contractile proteins in the platelets. They cause strong contraction of the platelet spicules attached to the fibrin. This action also helps compress the fibrin meshwork into a smaller mass. The contraction is activated and accelerated by thrombin and by calcium ions released from calcium stores in the mitochondria, endoplasmic reticulum, and Golgi apparatus of the platelets. As the clot retracts, the edges of the broken blood vessel are pulled together, thus contributing still further to hemostasis. Now, let's discuss the positive feedback of clot formation. Once a blood clot starts to develop, it normally extends within minutes into the surrounding blood. That is, the clot initiates a positive feedback to promote more clotting. One of the most important causes of this clot promotion is that the proteolytic action of thrombin allows it to act on many of the other blood clotting factors in addition to fibrinogen. For example, thrombin has a direct proteolytic effect on prothrombin, tending to convert it into still more thrombin, and it acts on some of the blood clotting factors responsible for formation of prothrombin activator. These effects include acceleration of the actions of factor 8, factor 9, factor 10, factor 11, and factor 12, and aggregation of platelets. Once a critical amount of thrombin is formed, a positive feedback develops that causes still more blood clotting and more thrombin to be formed. Thus, the blood clot continues to grow until blood leakage ceases. This was all about this section. In our next section, we will talk about the extrinsic and the intrinsic pathways.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.